Hi, my name's Sharon Lane, and I'm one of the recruiters here at UAB Medicine. We'd like to introduce you to UAB Medicine. We're comprised of several organizations all under the UAB Medicine banner, including hospitals and clinics. And we're going to take you through just a few of the things that we have to offer in terms of our jobs. Of course, we're an academic medical center with over 1,100 beds, numerous clinics throughout the community, and of course, we're the largest employer in Alabama, one of the 150 best places to work in healthcare. I'll let you read most of this, but the main things to take away are we're level one trauma center. We also have a regional neonatal ICU, comprehensive stroke center, cancer center, and also known for our transplant center as well. And if you are a nurse, we're 5 times designated as a magnet organization, which means that our nurses have a lot of autonomy. They also have a lot of ability to directly impact decisions that are made at the bedside as well. Some of the other areas that we have that are very important that we're looking for to hire people for is medical imaging, sonography, as well as our nursing. And we love Wallace State grads, so we hire a good number of you folks from Wallace State to work in our hospital and clinics. For medical imaging, we have Eric Williams here. He can talk to you a little bit about that. We have some of the most innovative technology around, and he can talk to you specifically about that. But we do hire rad techs, CT techs, MRI, nuclear. We also have cardiac cath techs that work largely in our heart and vascular center. So if you see jobs posted for HVC or Heart and Vascular Center, that's where those positions would be, as well as the interventional radiology tech. I didn't know if Eric wanted to say a few words at this point. I think you're on mute, so you'd have to unmute.
I'll step in for a moment. I'm Christina Lawrence, and I am the recruiter for HR, and I handle the radiology and sonography recruiting, and wanted just to step in and let y'all know that we provide an experience that's unmatched in the Birmingham metro area, covering all levels of care. And we have the emergency department, level one trauma center. We have a huge OR and just multiple ambulatory clinics throughout the metro area. We work hard, but we are passionate about patient care, and we have a friendly, team-oriented environment. And Eric has, joined us for this career fair as well to be available for any direct questions regarding the department. And if there are anything specific about working within the radiology department, if there are questions at some point, he would obviously be available and is here to answer those questions as well.
Thank you, Christina. We'll move on, and if you have questions at the end regarding medical imaging, Eric will be happy to answer your questions. We also have sonography, cardiac sonography, ultrasound technologists. We do hire new grads, which is great. We've also had recent salary realignment, so our salaries should be quite competitive in the marketplace and offer you good compensation for coming on board with us. In nursing, we have 3,400 plus bedside nurses, and it's growing every day as we continue to expand services. We have over 60 units, 9 ICUs. We've actually added 2 new ICUs in the last couple of years. We've got multiple nursing specialties, so even if you want med-surg nursing, you can specialize. So not everything that is specialized is ICU. We actually have rehab. We have multiple specialties within med-surg units as well. We also have psych nursing. We offer continuing education opportunities. If you want to go on for your BSN, and we encourage it, we actually have you sign an agreement that you will continue for your BSN, but we support you in that with our tuition assistance for UAB BSN. It's 100% paid, and there's no work contract at the end for that. We have professional nurse development program, which is a clinical ladder that after you've been here a year, you can go and get on that clinical ladder, and it gives you some more compensation opportunities, 5% or 10% above your base pay. Our UAB Center of Nursing Excellence and Nursing Practice is where our education department works out of, but it's more than just education to the unit, it's to develop you throughout your entire career. We have Nursing Practice Congress, which again goes back to our magnet designation, where nurses can elect a rep for their unit who can go to Congress and advocate for practice issues. And we work on those practice issues interdisciplinary. So you may be working with nursing, but you're also working with pharmacy, or you're working with imaging, so that we can get the best bedside practice there on the units. We have 4 scholar programs, including geriatric scholar program, an addiction scholar program, as well as a couple of others. We've just revamped our RN residency program, so that's excited. And as a new grad, as a new employee, you would automatically, there's nothing to apply to for the residency program. If you're hired, you're automatically in the residency program. There's been a perception out there that we don't hire associate degree nurses, but we definitely do, and we have all along the way, even when we moved to wanting people to complete their BSNs. And there's sign-on bonuses for some units. So just ask your recruiter once you start interviewing and things, just ask your recruiter about what bonuses are available at that time, because they do change. We have great benefits. We lead the industry in medical, dental, vision. We also have things like pet insurance, identity theft insurance. We have generous paid time off that you can roll over year to year. We have a 403B, which is like a 401k, but it's for not-for-profit organizations. And we do match, and you're vested with that match. And like I said, the education assistance at UAB is 100%. In addition to that, for the employee being 100%, we also have some 50% coverage on undergraduate programs for dependents. If you have a child going to school, or if you have a spouse going to school, we can help with that too. We are an organization that falls under the banner for the federal Department of Education that designates us as a public service loan forgiveness program. So that's a federal program. It's not administered by UAB, but because we are UAB, it may qualify you to have some of your loans forgiven through this federal program. We also have paid parental leave, which is unusual for a lot of employers. We're one of the few that does have that. So that's paid parental leave. It's totally paid by us, and it's for moms and dads and anyone else who's adopting or giving birth to kids. We also have a lot of employee perks at different restaurants and local businesses in the area, and we have a wellness and employee assistance program as well. So we'd love for you to join our team. We are UAB Medicine, but as I said, we also fall under different entities that all come under that umbrella. So we actually have some of it is separate application portals. And so this will enable you to follow us on social media, learn how to apply, who to reach out to. But we would definitely love to have you come on board with our team. So Christina Lawrence, who spoke to you earlier about imaging. I'm Sharon Lane. Jackie Westbrook is lead nurse recruiter. Victoria Andre is with us today as well. She's HSF. And Katie Maddox, HSF is Health Services Foundation, and some of the clinics fall under them. Katie Maddox is also a lead recruiter with us. So just if you reach out to us at this email address, one of us will answer you. So you can learn more about UAB Medicine coming up and some upcoming presentations that we have planned. So feel free to join us there.
The most important things that I'm looking for on a resume is obviously their education and their status in regards to certification. Even if they're in the process of applying for their credentials with the ARRT, that's really important for us to know, just kind of to get a status on where they are in that process, because it is important to us eventually. I mean, we are certainly willing to hire new graduates. That's great, and love the Wallace State program. Quality students coming out of there, and our requirements are for the ARRT, but it's an eligibility status at the beginning. So it's we definitely give time to obtain that credential after the fact, but it would be something that we would need in the future. So that's important for us. Any kind of patient care experience involvement, if they've had any, is nice to see. Just a nice clean resume detailing their education, detailing any work experience that they've had, and those are some really key things for me as a recruiter that I look for. Now, in regards to skill set, obviously, we are a teamwork environment. Teamwork is very important. Willingness to work hard, and just that desire to be a part of the team and learn all kinds of things. The UAB has a great opportunity for new students to really solidify and gain experience in all levels of imaging. And so that is, students who are wanting to learn and really wanting to solidify the skills that they have through their education program as they come on board and start their profession. That's key. And if Eric would like to add anything at this point.
So Christine, all the things that you mentioned is in line, in regard to what we're looking for. As you mentioned, working here at UAB, the experience is unmatched, as we're on the level 1 trauma center, state of Alabama. So therefore, we're looking for students who are willing to come in to learn, and that's motivated, and that's patient focused, because although we work hard, we keep the patient first. So all those skills, all those intangibles are very important. But the main thing is that, that they are registered eligible, ART registered eligible, which you achieve once you complete the program. But the main thing, and we love new grads. In particular, I must say, the Wallace State students have been very, very good. So we're happy to have them on board. I've actually had several that has worked since, I think we've had the Wallace State students for 2 years now. And most of my rad tech assistants were Wallace State students. And therefore, they've been very, very instrumental, in our department, coming in, learning the basic skills of radiography. Diagnostics is the entry level job of all radiology. So you come in diagnostic, learn your trade, and then all of a sudden, you find yourself moving up the ladder, going into some of the specialty areas. One thing is that I have observed that I would like to see more initiative, in regard to going out to learn all the different aspects of diagnostics. Diagnostic, we do a lot of portable radiographs, and also patients that come down to the department, inpatients, outpatients, so on and so forth. Just initiative to go into to learn all those skills that's necessary to be a great radiographer.